startup village that houses innovation labs supported by industry leaders. DSU provides a platform to visionaries and inventors to experiment their ideas. Globally reputed MNCs that include Autodesk, Bosch Etos, IBM, GE, VMware, NVIDIA, and Boston, Bosch Rexroth, Dassault Systems are now part of the DSU initiatives. These companies have invested vast resources to create a one-of-its-kind facility to be used by the community. Joining this great movement is the support from industry bodies, Indian Electronics and Semiconductors Association, Manufacturers Association of India, and Indian Institute of Science in Bengaluru. The Startup Village will now receive guidance from Arizona State University, Rochester Institute of Technology, and Illinois Institute of Technology, Chicago. With a reputation for innovation, are strong backers of the DSU initiatives. Distinguished individuals from industry, academics, research, government are lined up to mentor each of the entrepreneurial ideas to ensure all good ideas meet with success. A bouquet of specialists on call, patent lawyers to accountants, costing and taxation specialists, company secretaries, procurement engineers, bankers, designers, packaging specialists, logistics experts is one more feature of the DSU campus. Every year, groups of individuals enter the DSU portals with a burning passion and a dream to achieve. With the combined support and resources at their command, they are now sure to walk out of the DSU campus as owners of the companies enlisted on the National Stock Exchange and a university degree. The ecosystem created by DSU can now accommodate 300 enterprises and welcomes the community to take advantage of this great option and work towards making India a strong manufacturing nation. For passionate and innovative youth, Bengaluru is the place to be, and presenting a ready platform is DSU.
So we are good to go.
Yes, sir.
Right. So good afternoon to all of you. A very warm welcome to today's afternoon session. Morning we had a session on computer science engineering, again for the students from Andaman and Nicobar. And here we are with another very, very interesting session on careers in allied health sciences and way forward. This has been organized on the request from the president of Andaman and Nicobar School Association, Mr. Y. Sanjeevan, based on his request and from certain principals from certain schools, C.B.SC schools from Andaman and Nicobar for their students. This particular session has been organized. The live streaming is also being done on YouTube, which I think certain amount of schools are being watching it from the YouTube. So here we are presenting to you today the careers in allied health sciences. It's the most sought after a course in the medical industry. We have today some distinguished speakers. Before that, would like to give a small introduction to the allied health sciences and careers and job opportunities. The healthcare sector is one of the rapidly growing industries, and India is becoming a global healthcare hub. The healthcare system in the country remains unable to meet the health needs of the population because of many factors, most prominent being acute shortage of skilled manpower. Availability of human resources at all levels of the healthcare system is extremely essential in moving towards the larger goal of universal health coverage. Allied health science is a new established concept in healthcare and constitutes to a separate stream of health professionals contributing to healthcare. Allied health science professionals are an integral part of the medical team along with the physicians and nurses contributing their expertise to preventive, curative, and reliability care of the patients. These candidates are enabled to assist confidently in technology-driven medical procedures. The course provides a broad-based foundation in global and national healthcare issues and trends, ethical and legal issues, health promotion and disease prevention, evidence-based practice, allied healthcare research, healthcare system management, and healthcare-based informatics. With the enormous development in the healthcare industries, these graduates will be much in demand, both within the country and outside as medical technologists. With this, I would like to take the opportunity of introducing our distinguished speakers for the day. I start with the speaker number one. I'd like to introduce Dr. K.N.B. Murthy sir. He is the Professor for Computer Science Engineering and the Vice Chancellor at Dayanand Sagar University, Bangalore. Sir has been the former Vice Chancellor for PES University, Bangalore. Sir holds a bachelor's degree in electrical power engineering and a master's degree in electrical engineering from Indian Institute of Science, Bangalore. Sir holds a PhD in computer science engineering from Indian Institute of Technology, Madras. He has worked as a research specialist in parallel computing at New Mexico State University, US, and is currently a member of the Karnataka State Higher Education Council and the Academic Senate member of IIIT Dharwad. Sir, a warm welcome to you.
Thank you, Chandrik.
I'd like to introduce the speaker number two, Professor Dr. Pushpa Sarkar. She's currently working as the Dean for the Allied Health Sciences and School of Health Sciences, has worked as a director for the Rajiv Gandhi University of Health Sciences. She is the board member of various reputed institutions at Karnataka and a visiting faculty to various medical colleges of Karnataka. A warm welcome to you, ma'am.
Thank you, Mr. Shilpa.
Our next speaker for the day is Dr. Shilpa. She is the professor and HOD for biochemistry at the Chandrama Dayanand Sagar Institute of Medical Education and Research. With over 15 years of experience, she's been a state topper for Rajiv Gandhi University of Health Sciences in MBBS and won 5 gold medals, have attended various conferences and has many publications to her credit. A warm welcome to you, Dr. Shilpa.
Thank you, Mr. Shinde.
After Dr. Shilpa, we are followed by Dr. Shanmukappa. He's qualified from the Mysore Medical College, worked as a deputy registrar and the deputy director of Rajiv Gandhi University of Health Sciences, a nodal officer to the state for establishment of the RT-PCR labs for COVID. Is also the academic council member for SDM University, presently working as an associate professor in charge of COVID-19 lab and in charge of academic activities at MIMS Mandya in Karnataka. A warm welcome to you, Dr. Shanmukappa.
Thank you, sir.
And finally, we also like to introduce Dr. Tejasvi HL. He is currently the professor for anatomy and the coordinator of medical education unit at Adi Junjugiri Institute of Medical Sciences. He is also an adjunct faculty at the Department of Medical Education, St. John's Medical College, the NMC Nodal Center for Faculty Development. A warm welcome to you, Dr. Tejasvi.
Thank you, sir.
I also would like to welcome and thank a special welcome to Mr. Y. Sanjeevan, a resident of Port Blair and the president of the School Association at Andaman and Nicobar. This exclusive webinar has been arranged on his request. During his visit to Bangalore last month, he expressed his concerns on having career guidance sessions from leading universities for aspirants of Andaman and Nicobar. He is born and brought up in the Andaman Islands and has been working under the Education Department for last 30 years. Presently heading as the president of Andaman and Nicobar Teachers Association, also called as the ANTA, which has over 2,500 teachers serving across the islands. The objective of ANTA is to improve the quality of education in the islands, and so it's an obligation of his community to make the school education meaningful by guiding the students into their future. Thank you so much, Mr. Y. Sanjeevan, for giving Dayanand Sagar University an opportunity today to present the various from the distinguished speakers on the allied health sciences. I would now like to take the opportunity of inviting our Honorable Vice Chancellor, Dr. K.N.B. Murthy, sir, to share your views. Over to you, sir.
Yeah, thank you, Shinde. Good afternoon, my co-panelists, Dr. Pushpa Sarkar, Dr. Shilpa, Dr. Shanmukappa, Dr. Tejasvi, and also thank Sajeevan for taking all the efforts for inviting Dayanand Sagar University to present some information about allied health sciences. 3 or 4 things which the university has been doing. University is based out of Bangalore. You are aware that Bangalore is one of the most sought after cities in the world. It is emerging as one of the best cities in terms of every aspect that we are going to consider. Therefore, Bangalore is considered to be the destination for most of the things. We are extremely happy and proud that we are based out of Bangalore. What Dayanand Sagar University has been doing is to present information to create awareness among the aspirants to make an informed choice with regard to their higher studies. We are aware that there are good number of students and aspirants from Andaman Nicobar is looking for a university for pursuing the higher studies. This is the third webinar that we are presenting in the last 2 days. We had one webinar yesterday on law programs. Today morning we had the presentation on computer science. Now it's about allied health sciences. Whenever we make the information available to you, we would like to touch upon the following points. However, the experts would give you the details about the program. My job is to set the context to ensure that you understand the broader perspective of a program which is being offered at Dayanand Sagar University. Let me briefly touch upon the things that are happening in the market today. One thing that's happening in the market today is that the job opportunities for every program of study is increasing tremendously in the last few years, but the future in the next 5 years, it will be much more higher than what we have seen in the last few years. One estimate says that the number of jobs available will grow from 41 million to 191 million across every field of study, be it allied health sciences, engineering, medicine, law, commerce, management, etc. Therefore, the job opportunities exist in every field of life. Second, job opportunities also exist for specific areas which are being considered to be specialized. One such program of study, one such field of study is allied health sciences. Allied health sciences mostly going to deal with the instrumentation part of it and also the data part of it, where there's a lot of instrumentation, where measurements are being done and also data is being collected. This data is going to be very, very important for a clinical doctor to take it forward. Therefore, the role of an allied health professional in the future is going to become very, very crucial, very, very important. Therefore, the programs in allied health sciences mostly deal with the instrumentation part of it and the data part of it. Therefore, the knowledge of data, the knowledge of interpretation of data, the knowledge of presentation of data becomes very, very important, very, very critical. Therefore, anybody who aspires to do a program in allied health sciences need to make these 3 important information for themselves. One, what is the talent that you have for pursuing a program of study in allied health sciences? If so, which program of study? There are lots of programs that are available. Decide which one is the program of study you're looking at. Is it a cardiology? Is it audiology? Is it optometry? Things of that type. That's one thing which you need to look at. The second, you also need to identify the talent that you have. What's the background that you have? Do you have any prior knowledge of any of these things which we are talking about? If these two things are very clear, I'm sure you are ready for doing a program study in allied health sciences. The next thing also you need to know is what are the rigors of study? Means after joining the program of study, how do you go about studying this program of study so that you come out as a successful allied health professional? What contribution that you can make to your profession, to the community? That's what is to be understood very, very careful. Then the next thing that you also need to do is, where do you do this program study? Is it a particular institute? Which institute? In my understanding, you need to join an institute or a university which understood the essence of national education policy. You are aware that national education policy has been brought in by Government of India. Dayanand Sagar University is one university which is adopting some of the incorporating the components of national education policy. One important thing that national education policy recommends is to have flexibility in studies. I'm sure Dayanand Sagar University will try to provide the flexibility. That's one important thing. The second important recommendation of the national education policy is to have multidisciplinary learning. Though you are going to specialize in cardiology, you also need to know all the allied subjects so that you become a better cardiology health professional, cardiology allied health professional. Therefore, it's important to understand, is it only that particular thing or allied, the related kind of components? Therefore, multidisciplinary learning becomes very, very important. Therefore, what is possible is that apart from learning what you are going to learn in the program study, you also need to have some information, some knowledge of the allied programs, which provisions have to be made by the university. Dayanand Sagar University does that. The next important thing that's also required is with regard to join a university which provides you an option to learn all these things using technology, because technology is going to play a major role in the future years of time. It's been predicted that technology will get into every walk of life. Therefore, technology aided or driven data collection, data interpretation becomes very, very important for allied health professionals. And Dayanand Sagar University would provide that also, where they'll provide you the technological tools to be used in the instrumentation as well as the data part of it. I'm sure in the course of next 1 hour, the experts would tell you what is each program of study, how it's going to be offered at this university. And with this few opening remarks, I invite the experts to take over and let us know the details of the programs, and wish all the students who are joining this program all the best, and thank the organizers for inviting me to be a part of this webinar. Thank you. Thank you very much.
Thank you so much, sir. I would now like to invite the Dean, Dr. Pushpa Sarkar, to please share her thoughts on this topic. Over to you, ma'am.
Thank you, Mr. Shinde. I would like to do a screen sharing.
Yes, ma'am. Exactly.
Where do we do this? Video na madam.
You are able to screen share, ma'am? Geeta, go on mute. Ma'am, you are able to share? Ma'am, are you able to share? You are on mute.
Yeah. Can you see the screen, Shanda? Is it visible?
Not
No,
yet, ma'am.
ma'am.
You need to just go to the screen sharing button down, which is a green color button.
Yeah, I went there and
You need to then select your PPT and then just double.
I've done that.
It's not come, ma'am.
It's not visible.
It's not visible. Do you want me to then show it from my screen?
If you don't mind, Shanda.
Yeah, sure. I'll just pull it up. One second.
I've sent it through mail to you.
Yeah, I have it.
I can see it on my screen as of now.
Okay, no problems. I'll share it right now. Great. Are you able to see it, ma'am? Able to see it, ma'am?
Yeah, but please.
Yeah, I've already shown it from my screen.
Okay. Am I audible?
Yes, ma'am. You are able to see my screen, right?
Yes. Very good afternoon to everybody. Respected Honorable Vice Chancellor, all my fellow panel members, Mrs. Shinde, and dear students, and all the participants. Very good afternoon to all of you. So today we are looking into the allied health sciences careers and way forward. Now, when you're talking about allied health sciences, now when you see health sciences in general, post-pandemic, the entire focus is on the health sector as of now. Now, when you say health, now as students, you just cleared your +2. Now, what comes into your mind when it comes to health is doctors, and the most the nurses. So, health workforce in Indian scenario also has been defined with focus mainly on doctors, nurses, and few others. Now, very little has been done to estimate the need and also identify the competency of other healthcare providers beyond these doctors and nurses. Now, many other professionals belonging to more than 50 healthcare professions, they remain underutilized and also unregulated in the present Indian health system. Now, the advancement of the health sector is now warranted to create a fresh vision on the healthcare delivery with a patient-centric approach and focus on moving to a multidisciplinary team. Right? So when we say that, like, if you see COVID, we saw that people couldn't come to the hospitals. There was so much of transport wasn't there. So much of hue and cry, they were restricted in their homes and so on and so forth. And who came also, they weren't tended to because of the shortage in the skilled manpower. Now, this is a stark reminder for the need to implement new ways of deploying these health workers and improving the access to the quality services through qualified and competent these allied healthcare professionals. Now, who are these allied and healthcare professionals? Shinde, could you go to the slide after the pictures? After these photographs down.
I move to next.
No, next, like soon after all the photographs.
Sure.
Yes, close. So the printed matter.
Sure. Just one by one, I'll take it. Yes.
Now, the next slide also is what you have already spoken. The next slide.
Yes.
Now, who are these allied and healthcare professionals? Now these allied health professionals, they play a critical role. What we can say is that they are the support pillars of the healthcare system. Now, they are involved in the delivery of health or health-related services with expertise, contributing to therapeutic, diagnostic, curative, preventive, and rehabilitative interventions. They work in interdisciplinary teams, including doctors, nurses, public health officials, to promote, to protect, to treat, and to manage a person's overall health. Now, when we are saying that, if you're seeing, many of you also, you're seeing the members of your family who underwent this COVID test. There's so many of them taking the samples and also helping out in the diagnosis. We're processing the samples. That's only a part of it. We call them as the medical laboratory technicians. Likewise, you have many other health professions. As an example, I'm giving you where all of them could help in taking the samples, giving faster report to the patients. Now, what we are saying now next is that whatever we say in conclusion, when we say this allied healthcare professionals, due to the ever-increasing disease burden on the society, a scarcity of the medical doctors, scarcity of the nurses, and due to the critical role which are played by these allied health professionals, in today's healthcare delivery system, is necessary to build capacity among these allied health professionals, so to ensure that they're appropriately skilled. Next slide, Shindu. Okay. Now, the education and the training imparted to those undertaking these professions were not regulated all these days in India. And therefore, it was not registered with any regulatory body. If you know that, for example, for doctors, you have Medical Council of India. They are called registered medical practitioners. Likewise, for dentists also, you have registered dental practitioners and so on and so forth. Now, we did not have any of these regulatory bodies, but as of now, in 2021, this NCHP Act came into existence. Now, this is called National Council for Allied Health Professions Act. Now, this provides the regulation and also maintenance for the standards of education and also services by the healthcare professionals. That means you say your curriculum, everything, what is supposed to be taught, how it's supposed to be taught, and what are all the ethics and to be provided in that services provided by these healthcare professionals. Now, henceforth, they'll be registered with respective state councils. So, after completing this course, the graduates will have a registered number. They'll be registered, which is unique to each of these professionals. Next slide. Now, these are the programs what we are offering. You can see through the medical laboratory technology, the emergency and trauma care technology, anesthesia and operation theater technology, and you have the medical imaging and radiology technology, renal dialysis technology, cardiac care technology, and optometry, and bachelors in audiology and speech language pathology. The last one, to make it simpler, it's earlier called as speech and hearing. Now, these are the programs offered in DSU. There are many more of these. As I was telling, there are almost 53 courses listed under this NCHP Act. Now, what do these courses do? These courses provide a broad-based foundation in the global as well as national healthcare issues and trends. You will be learning about the ethical and legal issues, health promotion, disease prevention, evidence-based practice, now allied healthcare research, healthcare system management, and healthcare-based informatics. Now, in conclusion, we can say these candidates will be an integral part of the medical team and will be enabled to assist confidently in the technology-driven medical procedures. You know that technology has seeped deeply into the health industry. And of course, the doctors will not be available to use all these gadgets, all these equipments. And we require the allied health professionals to operate these and also assist in this technology-driven medical procedures. So when I was saying all this, like, disease prevention, evidence-based practice, and all these things, when I was talking about so much, maybe many of you would not understand the depth of this. Now where? So you should be very careful when you select a particular institution or where you are supposed to be trained. Now, it's a great opportunity to be trained in a medical college and a teaching hospital because you're exposed to a wide range of patients and you'll be trained under the doctors along with the medical students. You'll be taught in an environment where you're exposed to wide variety of equipments, on-hand, training and things. So what I would say is to go, coming to career opportunities, you can be employed in colleges, in universities, hospitals, private clinics, in research organizations, in medical transcription firms, in industries, then even in equipment manufacturers, even there you could be employed. Many places, you have this army hospital, you can get into defense. There are many opportunities. When we talk about placements, healthcare industry is one where you don't have a recession as such. There is no, you can say that in certain industries, you say the people lost their jobs. They were laid off because of various reasons. Now, this doesn't happen in healthcare industries. If you want a permanent solution saying that, I'm looking for a placement, what is my future after going to these courses? There's no looking back than the healthcare industry. This is the only place where you can see that everybody is employed. Each and everybody is employed there. And still, we have much more demand for this. There's much more shortage in this. And as our Vice Chancellor was mentioning, the job opportunities will increase like anything, 4-fold, 5-fold, so on and so forth. In healthcare industry alone, in allied healthcare, by 2030, across the world, it's projected that there'll be creation of around more than 40 million healthcare sector jobs. So you can understand that, what is the magnitude? Is so much more, much more than what you expect. And everywhere there's a high demand for these healthcare professionals. So with the enormous development of this healthcare industries, this AHS graduates, there will be much in demand, whether it's in India or abroad. And healthcare professionals, they're when empowered, they can really be the leaders of change. And we at DSU, we see to that, we prepare a confident, skilled professional when you get out of this particular institution. So a quick look at the facilities offered at the medical institution where the allied healthcare courses are being conducted. Shida, can you go to the some of these pictures?
Yes, ma'am. It's already been shown. The gym facility.
Go to the start of the slides. Second slides. This is a Chandamada Sagar Medical College. And we have the next slide, we have the hospital where you are trained here along with the medical students, along with the nursing students and all the other healthcare professionals along with them, so that you also learn something about interdisciplinary also. All of you will be trained under one roof along with the medical students. You can see the facilities is the anatomy dissection hall. Then you have the museum, you have various labs. You can go, these are the various labs. You see the physiology lab, clinical physiology lab. Then you have the biochemistry laboratory. So this is another view of biochemistry laboratory. And there's a microbiology laboratory. And yes, the next slide. Sunday. Yeah, the Radiology Department, where you have the ultrasound here for the medical imaging technology. You have the ICU, and you have the post-op ward, the renal dialysis unit here, and yeah, the post-operative ward, and the OT, where the anesthesia and OT technicians will be trained here. Next, we have the OT complex. You have many more such OTs where you're posted. Then you have the demo room where you're given instructions. Then you have the lecture hall and a beautiful library where you can utilize the library, where you have all the books, journals, HSS. Then you have this the computer lab, virtual lab, where you can go browse. Then you have the small gym there, and you have the hostel facilities and the bus facilities also there. So this is about the Dayanand Sagar University. But however, what the best advice to take any of these courses where you have the aptitude, you can just browse and see to that what each of this, it will be put up on the website. You can look through it, where the need for each of these courses, we are offering around 9 programs here, where each of these, where or what is expected out of you in each of these, and your interest could be to take up any of these courses. We have other panel members who will throw some light in detail about the courses. Thank you all. Thank you, Mr. Shinde.
Thank you so much, ma'am.
Yeah.
And I'd like to invite Dr. Shilpa to please express her thoughts on the allied health science programs. Over to you, ma'am.
Good afternoon, all, and welcome to my dear students. I'll share the screen, Mr. Shinde.
Sure.
Is it okay? Can you see my screen?
Yeah, it just started. Yeah, now it's visible.
Okay. So
You can go to the PowerPoint mode. Yes.
okay. So I will be speaking about careers in allied health sciences regarding, as Madam has already told you all, that there are many allied health science courses. I will be speaking about medical laboratory technology and medical imaging technology. These two things, I will give you what are the career prospects and what are the job opportunities. Depending on your interest, you can select any of the courses mentioned. I'll be mainly first talking about medical lab technology. So before I come to what you study in medical lab technology and what are the job opportunities, let me give you a briefing, because you have just come out from your 12th standard and some of the 10th standard students are also there. See, whenever you go to a doctor, whenever I say healthcare, the first person who will strike your mind is a doctor. So whenever you go to a doctor, you're sure more than 70 to 80% of either your health issues or your parents or your grandparents' health issues, there will be a blood test or a urine test ordered, isn't it? I'm sure most of you would have visited a lab with a requisition for a blood or a urine test. So when you go to the lab, your blood sample will be collected and the report will be issued. Now you would have seen people working there who will take your sample, who will process the sample, and who will give your report. So these people are what we call as medical lab technicians. Okay, so the course you need to do to work in a lab is your medical lab technology course. Now basically, what do you study in a medical MLT course? As for any other allied health science courses, you will have the basic science subjects initially: biochemistry, physiology, anatomy, microbiology, pathology, and all that. And then it's, as Madam said, it's a 4-year course including 1 year of internship. So the basis is in the basic science: chemistry, biology, some amount of you will be studying about the instrumentation also, where what instruments, what techniques are used, like that. And you will be studying in whole about the diagnostic process, starting from the collection of the samples, collection of the specimens, and something called as separation. How do you test it? That means how do you analyze it and how do you report it? So it doesn't confine only to these areas. Now MLT has, the scope for MLT has grown beyond the basic things what I mentioned, which I will be highlighting in my future slides. Also, you will have to maintain patient data as I said, quality assurance, it's grown beyond the scope, right? And quality assurance is a very, very important thing. You can specialize in this field only, and your career prospects will increase if you have a special certificate course in quality assurance. Also, you will be supervising, assisting, etc. Now, what is the value of this MLT course? See, you will have, not all the students can afford an MBBS course, and not all students can enter in an MBBS course. And also MBBS is very stressful. We need not, there is no scope. Only if we do MBBS, we have to do specialization, we have to do super specialization. But in an MLT course, you can actually choose a variety of opportunities. You can either do specialization or practice immediately after you finish your basic degree. Now, work atmosphere will be very calm. You will not have any direct interaction with the patient. You will not be, wholly responsible, because you will be working under the guidance of a doctor. So the work atmosphere will be less stressful. Job opportunities will be very, very good. When I say job opportunities, one thing you see is a variety of job opportunities, and the other thing is a stable, secure career. Okay, so a career when you are employed as a MLT technician or in other areas, see, the lab is not the only area where you can work. There are so many other fields you can go. So your job will be very, very secure. And even if you want to change your jobs, you will get a variety of job opportunities anywhere you choose to work. Okay, so this is one of the careers with highest growth rate for jobs annually, and more than 50% of the growth rate is in this MLT sector only. As I said, it is in high demand, and your salaries are very, very competitive. You need not worry that because you are an MLT, that is the one of the main things which you will be concerned. But let me assure you, you will get very competitive salary to begin with itself. So in this graph, you can see the growth rate of the MLT technician, MLT technology course, which is reflected in yellow. Okay, so up to 30%. All other industries, it is only up to 11%, which is from 2012 to 2022 in the previous 10 years. But in the MLT sector, you can see the growth rate has been up to 30% in the medical lab technician course alone. So what are the specialty areas in this MLT course? So what if I do B.SC MLT, what are the areas of subspecialty which I can choose? You can have clinical chemistry, you can have hematology. Hematology is with which deals with mainly hemoglobin, complete blood count and things like that. Histopathology, you take a biopsy and examine, that is histopathology. You can go in for transfusion services, that is you can work in blood bank. Okay, clinical immunology and clinical microbiology, that is, you have seen COVID. When COVID came, there were special COVID labs established and RT-PCR was done. So that is what is called as clinical immunology and microbiology, molecular diagnostics. So you can work either in these areas. Phlebotomy is nothing but collection of blood, okay, sample collection. You would have seen nowadays there are many home collection centers. So one technician, if you order test from the home, one technician will come and collect the blood. So they are exclusive for phlebotomy. They've chosen that area. So you can work as collection personnel. And if you have a certificate course, or if you want to have your experience in quality management system, that also you can choose. Nowadays, all labs are going for NABL accreditation and conducting audits. Many organizations conduct 4-day, 1-week training in these audits. You can be trained and you can be appointed as quality manager in any lab. And laboratory information system is, now every report is computer generated. We don't use hand reports, isn't it? So the machine does the test and it goes to the computer automatically. So it's not so easy. That system itself is complex. So if you have experience and if you specialize in LIS system, you can be a specialist in that. Drug testing, toxicology and forensic science are other areas you can select. Okay, so you have challenging and wide career opportunities both in the public health sector, that is government job opportunities, and also in the private sector. So where are the areas where you can be placed? You can be, as it seems to be very straightforward, in labs, clinical or medical labs, either standalone, only standalone means only labs, or which is attached to a hospital or a medical college. Okay, so you can work in the labs, you can work in blood centers or blood banks, you can work in pharmaceutical industries or pharmaceutical labs. You can actually, this multinational companies is one area which is opening up to y'all. So if you're interested in working in big companies, see, all our tests are done by machines. Okay, so these machines, we have some personnel called as application specialists working in these companies who program the machines for us, who run the tests, who validate the machines. So most of these have completed their B.SC MLT, and they are drawn, like, you know, you can apply for multinational companies like Beckman Coulter, Johnson & Johnson. There are so many. So they will take you and they will train you, and they will hire you in quality assurance department, R&D, or as application specialist. So you can work in multinational companies also, and in labs attached to medical colleges. Now, what does this mean? See, medical colleges, for MBBS students, we have these courses, biochemistry, physiology. So to conduct their practicals, we should have a lab, isn't it? So you can join there as technicians and assist them, prepare the lab for their practicals and things like that. You can also join dairy industry and water testing industry, mainly in the government sector. If you are interested in taking up administrative and supervisory roles, that also you can take up after some years of experience or after having certain certificate courses in quality assurance, and you can be appointed as a lab manager, hospital outreach coordinator, etc. LIS and data analyst I have already mentioned. You can also work in vaccine manufacturing labs. Teaching, if you're interested in teaching, you can do higher education like MSc, MLT and PhD and opt for teaching or academic careers. You can join R&D section in multinational companies if you're interested in research, and sales, scientific writer and occupational health are the other areas where you can join. See, all these areas I mentioned, unlike MBBS, you don't have to compulsorily do a specialization degree after this higher education or higher degree. If you're interested, you can do MSc, MLT and PhD and things like that. Or if you want to stop at BSc and join a job, that is also okay. After some years of experience, 3 to 5 years, if you have in one particular area, you will be automatically considered, you know, as a sort of having specialization in that area. So higher education, if you want, if it is your option, if you're interested, you can do it. Or if you're looking for quick job opportunities, that is also okay. And you can select, even without doing a higher education, you can select a specialty field after some years of experience. So that is about medical lab technology. I hope you have got a gist of it. Now coming to medical imaging technology, which is closely related to diagnostics. When I say diagnostics, it need not necessarily be only lab tests. Most of you all would have visited a diagnostic center for an X-ray or a CT scan. Now you would have seen people there taking X-ray, taking the film, taking CT scan. So these are the people who have done a medical imaging technology course. So that is also in very, very high demand. As you know, the diagnostic centers are booming everywhere. And without these diagnostic centers, that is either X-ray or lab, I don't think medical profession would be sustainable. So it is in high demand, and you can, not only in diagnostic imaging technology, you can also, even they use, you know, this radiation principle for treatment of cancers, radiotherapies, okay, interventional nuclear radiology, radiation oncology. You can do some course or specialization in that and join any one of these institutes which offer them. Okay, so innumerable career opportunities are there in hospitals, clinics and imaging centers. Also, as I said, for MLT, the manufacturing, the machine equipment manufacturing companies can hire you. They will give you enough training and you can work in those companies in the R&D or scientific writer or as an application personnel. If you are interested in academics, after higher education or higher degree, you can join the academics and the teaching profession also. So nuclear medicine centers, cancer centers, research, diagnostic centers, there are varied opportunities for you in each direction, whichever direction you want to choose. Either you want to choose higher education or be satisfied with a basic degree, you find opportunity in every direction in these two courses. That is the specialty of this allied health science courses. Finally, I would like to conclude by saying that I didn't choose the lab life chose me, because you're a very, very important part and you actually contribute a significant part to the society, because without allied health science professionals, doctors will not be able to give their best. Thank you very much.
Thank you so much, ma'am.
Okay.
Yeah, you can just you can stop the screen sharing.
Thank
Thank you so much. It's a wonderful insight to students.
Thank you.
If the students have got any queries, there's a Q&A box provided. Students can always put in their queries. And as the speakers get free, they will be able to look into those queries and answer to it. Thank you so much, ma'am. And I would now like to invite Professor Dr. Shanmugappa to please share his views on this topic. So do you want me to share your PPT?
Yeah, if I am enabled to share my screen, I'll do that.
Sir, I can do it because I've already pulled up the PPT.
Fine, sir. Fine.
Yeah, here it is. And 1 second. Yes, sir. Is it visible?
Yeah, it's visible. Thank you,
Go
sir.
ahead.
Good afternoon, one and everyone, and I hope I am audible clearly.
Yes, sir. Yes, sir. Yes, sir.
Good afternoon to everyone, and I am delighted to know that the audience are at plus 10 and plus 2 students. Actually, it is. I'm very happy to convey what are my views regarding the courses like optometry and audiology and speech language pathology courses. In the beginning, I would like to tell the students that nowadays it is a technology area, I mean film era, and anything you want, you will just end up in Googling. If you just Google optometry courses, you will end up in seeing so many courses, right from certificate to diploma to bachelor's degrees. So is with the audiology and speech language pathology courses also. But my request to all of you, to the students who are aspiring for the allied health science courses, is always think about a bachelor degree awarded by an university recognized by UGC. So that is one most important thing when you are selecting a course, particularly in any course for that matter. So if you are not able to get those courses, then you can think of diplomas which are awarded by various boards, state boards, paramedical boards, or institutions. But always make sure that you give a preference for the bachelor degree courses. So next slide, sir, please. To start with, optometry, B.SC in optometry, it is, remember that it is a full-time undergraduate program, that is a 4-year degree program, which includes a training period of 1 year, and an optometrist can be called as a doctor of optometry also, but he is not a medical doctor. But of course, as Madam Dr. Shilpa has told, no medical field is complete without an allied health science specialist. It is highly evolving nowadays, and the scope for the improvement in healthcare, especially among the allied health sciences fields, is too much. So, but of course, they will not be called as a medical doctor. So the next thing, it is a dynamic and challenging career that offers a self-awareness, and there will be a work flexibility. You need not to work overnight or extra hours or something like that. It is a fixed time job, and you will end up having a good community respect, especially if you have done a B.SC optometry related to the eye problems. So next thing is, majority of you should know that there is an eligibility criteria to enter into these courses. The first and foremost criteria is you should have studied English as a language. So, and the next thing is you should have studied physics, chemistry, biology in your 12th standard. And now it is not mandatory, but in future, it may become a mandatory that they need to take up a national eligibility entrance test or a state level entrance test to join these courses. Next slide, sir. What exactly these optometrists do? Let me not go into the details of what they do, but yes, to give you a bird's view or just a gist of what they do, they detect the defects in the vision primarily, and they also detect is there any signs of injury, or is there any diseases, or is there any anomaly with the eye, or the problems, is there any with the general health which is affecting the eye. So such things are identified and the patients will be guided. For example, a patient or a person can come to you as an optometrist to just to check his errors of vision. So as an optometrist, while examining him, you may detect the errors of refraction, but you may also identify a general health problem which is leading to this vision defects. So such things, identifying and telling the patient. Previous slide, sir, please. So such identifying the such problems and telling the patients will earn a lot of respect for you from the patients who comes to you. So of course, right now, as Dr. Pushpa Sarkar madam has told, there is an Allied Health Science Act, and there will be a license to practice optometry in the coming up days, which includes eye exams, as I told you, and writing a prescription for the contact lenses or glasses, or finding abnormalities in the eyes. So there will be a license which will come in the near future for optometry course also. The next slide, sir. Is it a good career? Yes, it is a very rewarding one and excellent career opportunities for the growth also. Doctors of optometry have a high job satisfaction, excellent quality life, and in terms of income also, it is a pretty decent income. And to tell you here, to all the students, there is a much more demand all over the globe for these specialists. We do not have so much of specialists, especially in Southeast Asia, as well as the program is not very channelized, I can say. But yes, the India is going in a right way in forming a national commission for these courses, allied health courses, and it is channelizing. So I can see a very bright future for these courses. And of course, if the students are interested, they can do masters in the optometry, and they can, with the basic degree, they can branch out to different areas also. So there are countries where they offer the PhDs in optometry also. Next slide, please. So coming to the job opportunities, once you have done this course, yes, you can join as an optometrician, or you can join as a researcher. You can join nowadays the School of Allied Health Sciences is increasing day by day. So you can become a faculty in the school or college of Allied Health Sciences. You can become an assistant to an optometrist, or you can become a sports vision consultant and orthoptic specialist. You can become ocular prosthetic specialist if you can become later on after getting a desirable experience. And then practice, you can as well practice independently as an optometrician. Of course, nowadays, all of you might be there, might have heard I have gone for a laser assisted surgery for keratomyeliosis. So this surgery, for this surgery also, optometrician is a very important person to accomplish this surgery on the required patients. Next slide, please. Job opportunities or opportunities abroad, you have, the whole world is open for you. It's not only Canada or Australia or UK or USA, as I mentioned here, but the whole world is open for these specialists. The next slide, sir, please. So that is about optometry. Coming to the Bachelor of Audiology and Speech Language Pathology. So there are very, very few specialists in this field. To tell you, though this course is opened in India in 1966, till date around, as per a survey by one of the All India survey, in one of the article, it says there are only 16,000 graduates with this degree. Out of this 16,000, hardly 6,000 to 7,000 are working in India. The rest of all of them are in abroad, especially those who have obtained their degrees like bachelor degrees. So that is a scenario presently with this course. Coming to this course, as I told you earlier, it is very similar to the structure is the duration and the program is very similar to the optometry course. And the course, basically this course deals with the techniques, methods used in diagnosing and curing hearing as well as speech and balance related disorders among the individuals. It is a multidisciplinary one with the core subjects of pathology and language pathology and audiology. To become eligible to join this course, so you should have studied physics, chemistry, biology, and mathematics as their main subjects in the +2, and you should have studied an English as a language, and you should have secured a minimum 50% in the above 4 subjects. So in near future, the NEET may become mandatory for these courses. As of now, it is up to the state and up to the particular institute. But in future, I can see that the NEET may become a scale for judging who should enter these courses. The next slide, please, sir. So what do these BASLP holder do actually? They work as audiotherapist, speech pathologist, and hearing aids specialists, as well as there is a big market for hearing aids now. They can join as an instructor or a teacher. They can become a researcher as well as clinical supervisor, audiometry technician, or audiologist, or lecturer. So on, they can join. The next slide, please, sir. Career options, as I told you, if the student is interested, they can enter into the master degrees, and there is an MSc in audio speech therapy also, and they can go to the MA communication sciences and disorders, and healthcare management. Of course, MBA can be done by any degree holders nowadays, and MSc in molecular pathogenesis of audiology or speech pathology, and doctoral and research related studies also, as well as they can join as a faculty. And the next slide, please. So jobs, as I told you just now, the next slide, sir. Next slide, sir. Future of these courses, as Madam has already told, there is a council which has been already formed, and in every state, the state governments are taking steps to form their own state council for the methodical registration of these degree holders. And of course, once the council is in place, obviously the apex body will really look into the minimum standard regulations where these colleges should have in order to train the students. But remember that the bachelor degree courses are always better that compared to the other like diploma or a certificate courses. So bachelor degree courses awarded by a university is always a better thing to join. The next thing is opportunity for degree and postgraduate degree holders to be the faculty is more, because the more and more number of these colleges are getting established, and the students are aware, the parents are aware that yes, there is a future in these courses. So the opportunities are increasing day by day. The increasing awareness and depth of these professionals in India and worldwide. The whole world is open for these specialists, because the corona has shown to the world that how short the human resource in the healthcare sector. So that's about my presentation. The next slide, I think that's about my presentation. I would be very happy if the student has any queries to answer, and I take this opportunity to thank Honorable Vice Chancellor as well as Dean of Allied Health Sciences, Dr. Pushpa Sarkar and Mr. Shinde and all other speakers to bear with me for a few minutes. Thank you. Thank you so much, sir.
Thank you so much, sir. Thank you so much for the wonderful presentation. Would now like to invite Dr. Tejasvi Chil to please share the views. Over to you, Dr. Tejasvi.
Sir, am I audible?
Yeah, you're audible, sir. Your screen is also, yes, your screen is visible.
A very good afternoon to one and all. I would like to share my views on career opportunities in cardiac care, OT, and anesthesiology as a career. Let's begin with the cardiac care technology. Now, what exactly is cardiac care technology? This is a course. It's for diagnosis and treatment of heart diseases and diseases of blood vessels, basically. Now, this is about the course, like cardiac care technology. Now, what are the responsibilities of cardiac care technologists? Cardiac care technologists are those who complete the course. Now, cardiac care technologists would assist the clinicians, the cardiologists, but they will remain as the backbone of the intensive care unit, the cardiac care unit, or even the cath lab. Cath lab is a place where we perform a procedure called as coronary angiography or angiogram, where a tube is inserted into blood vessel to look where exactly the block is. That is what cath lab is. Now, as I said, the cardiac care technologists basically work along with cardiologists. They also work with cardiac surgeons, and they assist in preparing the patients for surgeries of the heart. They also help or assist the cardiologists or cardiac surgeons in implantation of cardiac pacemakers. They help in monitoring the patients during test procedures. They also help in performing ECG or other cardiac tests, and they also help in using as well as maintaining advanced equipment in laboratory settings. So these are some of the work responsibilities that cardiac care technologists do. Now, imagine you are allowed to work in an environment which would improve the health of the patient, and you are assisting the clinicians in improving the healthcare of the patient. Now, this is a wonderful job opportunity that all of us look for. Then, of course, the most important worry for all of us is, fine, once I do the course, what I would do. Now, remember, you can join hospitals as the cardiac care technologists or technicians. Then you can even join international health services. You can join government health services. You can join educational institutions as academicians, training other students. You can also work in non-governmental organizations, NGOs. You can always find a job in nursing homes or private hospitals. Now, there are wonderful job opportunities available once you complete the course. Then, what about the salary? What about remuneration? We all are more worried about this aspect also. Of course, it's an important aspect also. Now, the remuneration of the salary varies between 2 lakhs to 15 lakhs per year. I'm talking about per year, right? So on an average, every month, you would make around 20 to 40,000, 20 to 40K per month. Now, remember, the salary or the remuneration that you earn depends largely on the skills you acquire during your training period. And this is where you do the course, where you complete the course or training becomes very important. As Shanmugappa sir rightly said, and also as Pushpa Sarkar ma'am rightly said, choose the institution where you train very carefully. This would decide your career. So remember always, skills are the key. The skills that you learn during this training period is the one which will take you through or take you long in your career. Of course, with your skills and experience, the salary and other perks goes on increasing. This is in brief regarding cardiac care technology. Then, what about the OT technician or OT technology? OT technology basically stands for Operation Theatre Technology. Now, again, what exactly is this course? This course basically deals with every element that occurs in operation theater. Now, this could be pre-operative preparation. Now, what do I mean by pre-operative preparation? This could be as simple as shifting the patient to the operation theater, preparing the patient for the surgery, preparing a part of the patient for surgery. For example, a patient is getting operated on the arm, to prepare the part for surgery. Now, during the surgery, assisting the surgeon by providing instruments required, by providing other materials that are required by the surgeon. Then it also includes post-operative responsibilities like shifting the patient back to a post-operative ward, taking the absolute care of the wound or the surgical scar that has been produced. These are some of the job responsibilities that an operation theater technologist would do or carry on. Now again, once you complete this, the opportunities are wide open, just like the cardiac care technologist. You can work in hospitals, different sets of health services, let it be international, government. Again, you can join educational institutions, you can join NGOs, or you can join even nursing homes or private hospitals. So again, the job opportunities are quite wide, and it again depends on the amount of skills that you gather during your training. Now, regarding salary or perks that you would get, once you start training and complete it, maybe your salary would begin with 10 to 20,000 per month. But once you're experienced and you are skilled and you are recognized, it can go up to 30,000 or 40,000. With any of these courses we are discussing since beginning, remember, there is no cap on the salary or the remuneration that you will be earning. With increasing experience, your remuneration, your benefits, your perks will increase dramatically. The people will look for you. People will look for you to appoint in their setup, right? So remember, skills are the key. Then again, what exactly is anesthesia technology? Remember, anesthesia technology, as we know, basically deals with assisting the anesthetist or the entire anesthesia team prior to or during or following a surgery. Now, this is about making the patient unconscious so that surgeries can be performed easily, right? Now, this is basically anesthesia technology. So you would be assisting the entire anesthesia team. In fact, you would be a part of the anesthesia team. Now, again, like this course, once you complete, this is as good as completing cardiac care technology or even the OT technology course. But the only difference is here you will assist exclusively the anesthesia team. Now, again, the job opportunities are wide open, as I discussed with the earlier slides, starting from hospitals, different cares of health services, educational institutions, NGOs, or the private clinics or nursing homes. Again, the salary or the perks depends on your skills and experience, but it would be anywhere to begin with 20,000 to 40,000. Now, all these salaries and benefits we're talking about are at the current level or at now. Now, remember, once you complete these courses, maybe 2 years or 3 years from now, the salary that we are projecting here would only increase. There are no chances that this would come down. And again, as Pushpa Sarkar ma'am rightly pointed out in the beginning, the job opportunities for allied health professionals are increasing. They are increasing dramatically. And these are wide career opportunities that you would look for once you complete a professional course. This is what I wanted to share regarding the 3 important courses that form part of allied health sciences. Any questions from any of the students? I would be happy to share my experience or clear their doubts. Thank you. I would like to thank the management of the Anand Sagar University, Honorable Vice Chancellor Pushpa Sarkar ma'am, for providing me this opportunity to share my experience with you all. I also thank other panelists for their valuable inputs. Thank you, sir.
Thank you so much, sir. You can give the screen. You can stop the screen sharing.
Yes, sir. I'm doing it right now. Yeah.
Thank you so much.
Thank you, sir.
Yes. So here we are, students. It's been a wonderful time. I'm sure all of you must have enjoyed to hear from the distinguished speakers on the topic on the most sought after course in the medical industry. I'd like to thank all the distinguished speakers for making themselves available on a Saturday evening to share the ideas, career aspects, job opportunities, their experience sharing on the Allied Health Sciences programs. And big thanks to Mr. Y. Sanjeevan from Andaman and Nicobar Islands to have given the opportunity for Dayanand Sagar University to share its views. So students, here we are with the list of programs available under the Allied Health Sciences. These are the following 8 programs that are being shown on the screen is available. For further details, I would request all the students to kindly log in to our website, dsu.edu.in. You can go see all the programs. You can also have a detailed look at the medical school, which is available through the website, and then come back and fill in your applications. Any details, but you want more, you can also give us a call on our landline numbers, which is 080-4646-1800. Admissions are open. As you all know, some students are awaiting for the NEET results. Once that is out, generally within 2 days, most of the seats that are available at Dayanand Sagar University gets filled up. So in case if you're looking out for admissions and you want to take the advantage of the Bangalore advantage, please look at this particular website, and any queries, we'll be happy to resolve it. So with this, we come to the end of today's webinar. I'd like to thank all the distinguished speakers for their time, and also to all the students for being present for this particular webinar. Thank you so much. See you. Bye-bye.
Thank you, Shinde.
Thank you,
Shinde sir. Thank you very much.
Thank you so much, sir.
Thank you, Mr. Shinde.
Thank you, ma'am. Thank you so much.
All the panelists. Thank you so much. Thank you, sir.
Thank you. Thank you.
Thank you. Thank you.
Thank you all. Thank you.
Sajivan, thank you so much.
Thank you, Mr. Shinde. Thank you. Thanks a lot.
See you soon. The recording will be made available to you. You can share it with your participants.
So kind of you. So kind of you. I once again thank Dayanand Sagar University for arranging such a wonderful webinar for our students, for the students of Andaman and Nicobar Islands. I hope that our teachers also who have participated must have taken much advantage of this session. And I look forward to have a wonderful time in future too. Thank you. Thanks.
Sure,
Thanks a lot.
sure. See you. Thank you so much.
Thank you. Thank you.
Thank you, ma'am. Thank you, Dr. Silva. Thank you so much.
Thank you. Thank you, one and all. Thank you, Mr. Shinde.
Thank you so much, sir.